Hi, and welcome to the Breastfeeding Medicine Podcast. I'm your co-host, Dr. Ann Eglash. I'm a clinical professor in the Department of Family Medicine at the University of Wisconsin School of Medicine and Public Health and a board-certified lactation consultant.
And I'm your co-host, Dr. Karen Bodnar. I am a pediatric hospitalist at Inova Children's Hospital and an assistant professor of pediatrics at Virginia Commonwealth University.
I'm also a board-certified lactation consultant.
This podcast is produced and edited by the Milk Mob and is co-sponsored by the Academy of Breastfeeding Medicine. Are you ready to go? So today we're going to talk about obesity, and we've talked about obesity several times, but the story just keeps evolving to really understand what's going on with the connection between breastfeeding and obesity.
Yeah, it's really true. I picked a study today that it's pretty simple and the results we'll go over quickly, but the reason I wanted to bring it up is because I in the background of the paper, it summarized some of the other literature that has come out about the association of reduced obesity with breastfeeding. And I was interested in that background and thought it might be a great summary for some of our listeners.
Sounds good.
So the article that I picked from the Breastfeeding Medicine Journal from March 2017 is titled Breastfeeding Reduces Childhood Obesity Risks by Liang Wang, Candace Collins, and some of their colleagues. This study examined the effects of breastfeeding and its duration on the development of childhood obesity from 24 months through the 6th grade. The authors used U.S. longitudinal data collected from 1,234 children, and child height and weight were measured 6 times at the ages of 2 years, 3 years, 54 months, and in grade 1, 3, and 6. And they had data that told them whether or not those babies were breastfed at 1 month and at 6 months. And this was not exclusive breastfeeding. This was just any breastfeeding at those ages.
Mm-hmm.
The logistic regression that they did showed that breastfeeding at 1 month was associated with a 53% decrease in the risks for childhood obesity in 1st grade and 6th grade, respectively. The statistics that they did showed that breastfeeding at 1 month was associated with 53% decreased risk of childhood obesity in the 1st grade and 47% decrease in the 6th grade.
Wow.
As far as duration goes, babies that were breastfed for more than 6 months versus never breastfed were associated with a decreased risk for childhood obesity of 42%. And those are significant numbers. There's a lot in here about the far greater percentage of breastfeeding in the higher educated, married, white population versus the more socioeconomically challenged moms. And I think that that's something that we have seen over and over again. It's hard to control for those factors. But when they went into the background, they talked a bit about some of the studies that have come before them. So research has found an inverse relationship between duration of breastfeeding and childhood obesity. A recent meta-analysis reviewing studies from 12 different countries concluded that breastfeeding was significantly associated with a reduced risk of childhood obesity. The results showed a 22% lower risk for those who were ever breastfed compared to those who were never breastfed. And those breastfed for more than 7 months had the most significant decrease in risk. A similar review investigated how breastfeeding affects body composition of infants using 15 studies from a systematic review and 11 for a meta-analysis, and it was determined that within the 1st year of life, formula can alter the normal trajectory of adipose. I thought that was really interesting.
Yeah.
World Health Organization assessed 71 studies. Its pooled analysis showed children who were breastfed had reduced odds of becoming overweight or obese for those aged 1 through 9 years and aged 10 through 19. Another study examined the effect of breastfeeding on the weight status of 2 to 4-year-olds in the United States and reported those who were breastfed were more likely to have a healthy weight status at age 2 and 4. And a Chinese study concluded that those breastfed exclusively for 3 to 5 and greater than 6 months had lowered risk of becoming overweight by 13% and 37% respectively, compared to those breastfed for less than 1 month.
Mm-hmm.
Now, the reason I was particularly interested in this research is that some other studies have shown that breastfeeding and childhood obesity have a small or insignificant relationship. For example, one contradicting study conducted by the China Family Panel Studies found that there was no significant difference on the effect of breastfeeding for obesity or excessive weight. And the differences in study findings on the relationship between breastfeeding and childhood obesity risks could be attributed, according to these authors, to differences in study methodologies and analysis. For example, adjustments for confounding factors such as socioeconomic status, maternal BMI, and maternal smoking, which they found made a significant difference in their study. Definitions were different, sample size, and not distinguishing between exclusive and partial breastfeeding could have also made a difference. In addition, many previous studies defined obesity based on self-reported BMI and not on a standard measurement of height and weight. Lastly, a series of more appropriate methods for studying the relationship between breastfeeding and obesity has been established more recently. And so it's hard to compare more historic studies with the more recent ones.
Right. I'm always surprised, like when I look at like Cochrane, for example, which does systematic reviews, and they include a whole lot of studies, and then they talk about, first they look at all these studies and they have their criteria for what studies they're going to include, but sometimes they include studies where the criteria still are just not that great. They still don't control for the definition of breastfeeding, or they still don't control for factors like, maternal education, or, things like that. I think that, we really need, these larger meta-analyses and systematic reviews to be super clean as we get more and more into but just better study techniques. We're just learning about what needs to be done in terms of.
Yeah.
But I think that sometimes breastfeeding studies get done by people who don't really know the literature that well because they come from other fields like endocrine or like OB/GYN or something like that. And so then you end up with these studies that are just not as good.
Yeah, and sometimes, like this study, although I was impressed, I have to say, when you read through all the statistics, there are all sorts of things they took into account, like birth weight. Actually, in the group of children who were breastfed, they had a higher birth weight overall, which, you would think that they would be more likely to end up bigger later on. And so, they're really paying attention to those small details. But the data set they used was older. It was several decades old, and actually breastfeeding rates in this country have increased significantly since this data was collected. But I'm trying to do a project right now with data that was collected for a nutritional study, and I was not involved when they came up with the original survey questions. Mm-hmm. And there's so many questions that I want to ask that I can't ask because the data isn't in the data set.
Right. Yeah, that's what happens when you're handed a data set and you're not allowed to ask what questions, what questions.
Yeah, and they did a 6-month survey and they didn't do a 3-month survey, so I can't really look at exclusive breastfeeding at all because the 6-month survey was collected between 6 and 8 months, right. And so everybody's taking solids.
Right. Exactly. Yeah. Yeah, that's why you have to look at the literature carefully and, know what you're looking for. So,
yeah, absolutely.
Yeah, the truth is relative, right?
Yeah, it is. And it's fascinating the things that get published. And then, sometimes later there are corrections or retractions. And hopefully most people are doing it in good faith. But still, everyone makes mistakes.
Yeah, there can be fake news in breastfeeding, that's for sure.
No politics on the podcast.
All right.
What do you want to talk about?
So I want to talk about cortisol in human milk. So this was really interesting. This was a study that was published in the Obesity Journal in December of 2016. entitled Cortisol in Human Milk Predicts Child BMI. And it was authored by Jennifer Han Holbrook, Tran Bao Li, Anna Chung, and others. So we know, as you stated, that breastfeeding is associated with lower rates of childhood obesity. And we also know that human milk contains cortisol, which is known to play an important role in glucose metabolism and storage in general for people, for all of us. But now they're starting to recognize that maybe cortisol in human milk has an effect on glucose metabolism and storage in infants as well. So they were interested to find out whether or not early exposure to the cortisol in breast milk helps to modulate the infant's body mass index over the first 2 years of life. So what they did is so first of all, I want to mention that the glucocorticoid, cortisol, that's in breast milk is coming from mom's blood. And interestingly, it is absorbed from the infant's gut, and it also can get into the infant brain. So, because sometimes we say, well, wait a minute, hormones are broken down in the intestine. How do we know it's absorbed? Well, the authors state that there's evidence that it is absorbed, so that's important. This was a study of 51 mothers with 25 boys and 26 girls. And what they did is they measured the heights and weights of the infants and toddlers at 3 months, 6 months, 12 months, and 24 months. And then they just measured the breast milk cortisol at one point in time, which was at 3 months postpartum. And interestingly, they found that the higher the milk cortisol level at 3 months, the lower the body mass index percent gain over the first 2 years of life for girls, but not so much for boys. Meaning, like if there's a growth curve for body mass index, and girls lower the cortisol, the higher that they rise in their BMI. They actually become fatter. And so by 24 months, they found that the children exposed to more cortisol during breastfeeding, throughout breastfeeding, they had lower BMIs as compared to children who were exposed to less cortisol at 3 months. And again, this was really more specific to girls and really not noticed so much for boys. And interestingly, the other thing that's super interesting is that in terms of height, that breast milk cortisol level correlates with faster height growth. And these girls were taller and leaner at age 2 if they were breastfed than if they were, everyone was breastfed, if they were exposed to higher cortisol levels as compared to lower cortisol levels. And there was no association between the duration that they breastfed or whether or not they breastfed exclusively. So that was interesting because it was just that exposure in the first 3 months that seemed to make a difference. So they basically concluded that cortisol in breast milk helps to provide early metabolic programming, and higher breast milk cortisol levels can predict a lower body mass index and a greater height at age 2 for girls. And the reason why this is important is because other studies show that the body mass index at 2 predicts adult obesity. So if a child has a high BMI, like over the 85th percentile at 2, which is, overweight, and then over 90 or 95th is obesity. 95th is obesity, that predicts adult obesity.
Yeah, that was one thing they found in my study also, was that basically if there was obesity in those, 24-month-olds, that got worse and worse and worse in 1st and 6th grade.
Interesting.
They're already on that path.
Right.
So were these morning cortisols in all the participants? Because cortisol varies throughout the day.
It varies, yeah. It may have been, I can't remember if they were salivary. Like at our institution, we do salivary cortisols at midnight. And it was standardized. I can't remember exactly at what time.
It's so interesting.
Yeah.
I mean, we're always talking about the biological plausibility.
Right.
And it's an interesting idea. I think I'm going to wait for a little more research on this topic.
Right.
Particularly considering that the boys didn't seem to have the same effect.
Exactly. Yeah. It seems like it had a bigger effect on girls. And they also mentioned that there are some studies showing that breast milk cortisol plays a role in the maturation of the intestines, and also has in the breast milk cortisol seems to have an effect on the temperament of girls, but not so much on boys. And there was there was that, is it Dr. Hindi, who's from Arizona? I heard her speak at ILCA last year, 2016. And she's doing some work on cortisol and infant temperament. And finds a correlation with cortisol and temperament. Yeah. And then the other thing that's important to understand is that the amount that a woman gains, the amount of weight that a woman gains in pregnancy actually is a strong predictor of how much cortisol she'll have in her milk. So the less weight gain that she has higher cortisol levels. And so this might be like, this might be the epigenetics, and also, this sort of link the programming, because we know that people, we see kids who are overweight and their parents are overweight, and we think, well, they probably just, feed them lousy food, but, or inappropriate foods, but really the bottom line is that there are some genetics to obesity. And,
absolutely.
Yeah. And so the question is this one of those factors, where if a woman is naturally lean, gains 25 pounds during pregnancy, so not really gaining excessively, is she going to have a higher cortisol levels? And then is that part of the programming that allows her child to have, a normal BMI? But then there's other factors too that the authors pointed out that can have an influence on breast milk cortisol levels, particularly psychological stress can increase it.
Well, that's what I was thinking about when you first started, was actually, I had, and I've heard this many times, partly because I practiced in Southern California, but there is a cultural belief that I have found primarily in my Hispanic patients that mamas worry that if they're depressed or they're angry, that it makes their milk unsafe or bad for their babies. Have you ever heard this?
Oh, but
story?
this was, well, I have heard that, but I've also heard that, back in the early 20th century, we heard this as a reason for milk being bad, and then you should go to formula.
I don't, hearing this story doesn't make me say, oh yes, they should not breastfeed, but it makes me, think about like, where does that come from? And I also thought it's worth mentioning because one of the nurses I was talking to had never heard that before this week. And I thought, oh, sure, there are probably some of our listeners who have not heard about that. It's a pretty common reason that mamas have told me they didn't want to breastfeed before. And when I say to them, no, your milk is still really, really healthy for your baby, a lot of them are encouraged to proceed.
Right. But it would be interesting to know, I agree with you, to understand where that comes from and what people have noticed over the generations, in terms of like infant temperament and body weight and things like that.
It goes all the time. A lot of times when moms have postpartum depression, pediatricians and family docs are the ones that have the opportunity to see that because they're seeing the mom so frequently with the babies. And I found in the past that sometimes I pick up on it, not as much because of what the mom says, but because the baby is less interactive than a typical 2-month-old, because the mom has such a flat affect. She's not spending that time smiling at her baby and interacting with the baby face to face, and the babies haven't learned to smile as quickly.
Right. Yeah, they're not as animated, and they're not always looking at their mother because they don't get that reinforcement. Yeah, it's really sad. So, so that was it about obesity for today. But I want to mention one thing that I was reading that I just wanted to bring up. You know how a lot of women talk about like, oh, if I breastfeed, my breasts are going to sag. And did you ever wonder why the breasts sag after breastfeeding a couple babies?
Well, they've been pregnant a couple of times.
Well, so here's the thing.
I always was told it was the pregnancy, not the breastfeeding.
Oh, okay. Well, so if you're pregnant, your breasts automatically undergo differentiation, right? So what ends up happening, so I was just reading this article about breast changes, and actually what happens is that when the alveoli are developing during pregnancy, the fat that surrounds that glandular tissue starts to die off a bit in order to provide room for the alveoli. And so every time this happens, there's some death of that fat. So I think it's just that like loss of fat and maybe the the tissue, the supporting tissue, between the fat layers I wonder if that's really what's causing that loss of, what you would call perkiness or turgor, whatever we would call.
Well, and the progesterone's effect on the ligaments, I thought also was part of it, but I don't know.
Too.
We're going to have more of these mammary biologists come and talk to us.
That sounds like a really good idea. All right. Well, get your thinking cap on. And
it was fun talking to you, as always.
Talk to you later. Okay, bye.
Sounds good. Bye.
For questions regarding this podcast, contact us through themilkmob.org. We have other educational projects going on there, such as the Clinical Question of the Week and our Outpatient Breastfeeding Champion programs. If you want to see what we look like, check out our Facebook page, where you can also share comments and questions with your co-listeners. To learn more about the Academy of Breastfeeding Medicine, please visit www.bfmed.org. Thanks for listening. We'll be back with you in a few weeks.